everybody. It's Demetrius here with Claire and Motivators, and I'm here with my handsome husband, Chris.
Hi.
And we have some special guests that we'll introduce you to all in a second, but we just wanted to bring a conversation to you about COVID and the considerations for returning your kids to school. If you're anything like us, we are parents of a 2-year-old and a 4-year-old, and we are struggling with the decision as to whether to return our kids to school for in-person learning or to keep them home with us. And a lot of the information that we receive is very confusing and it is full of politics. And we have a special source that we get to go to try to remove some of that so that we're just getting the facts and we're able to have dialogue about what we think is best for our family. And we wanted to share that with you all. So we have Dr. Ramos here.
Hello.
Dr. Ramos is a physician and she's here to help us just give us some basic information about what we should know and what we should be thinking about when we're trying to decide whether to return our kids to school. And her husband is with her as well, Gavino.
How you doing?
And in addition to being a physician, Dr. Ramos is also a mom. They have a 14-year-old and a 12-year-old, and we're all in the same boat trying to figure out what in the world to do with our kids. So I'm going to turn it over to Dr. Ramos so that she can give us some information. And then once she's done, we're going to have a discussion. Dr. Ramos?
Hello, everybody. Thank you, Demetrius. Like Demetrius said, it is some tough times for everybody. As a physician, it's tough. And as a physician mom, it's even tougher. And being a physician and a mom, you would think would give us a little bit more insight, but it really doesn't because we get the same conflicting information. So my hopes today is to kind of provide you with just some of the basics. It may conflict with something that you have heard. One thing that's unique about COVID is a lot of times you come in and we've had this knowledge for years. We've studied it for years. We've been studying COVID for 6 months. So this is a time where we are kind of walking this walk and learning this together. So that's one reason why the information changes so much is because what we said 3 weeks ago, we have now learned that may not be applicable to today. But when you're returning your kids to school, that doesn't give you a lot of confidence because what do I believe? What do I know? Where do I even go to get this information? And so my hope today is just to kind of give you some basics and even just where to go to kind of find some of the basic information so that you can make the best informed decision for your family, because ultimately that's what it's going to boil down to. We can't say what's right or wrong, and it's not necessarily a right or wrong, it's just what fits. With COVID and going back to school, some of the bare basics is knowing what the symptoms of COVID are. You hear about with kids, oh, does kids get COVID or kids do not get COVID? If they do get COVID, what are the symptoms of COVID? And for the kiddos, the symptoms of COVID are very similar to what we would expect as adults, what you've heard about with adults. It is the big symptoms: fever, cough, shortness of breath. A fever, by definition, is a temperature greater than 100.4 or above. And then some of the other symptoms that you hear about commonly is loss of taste, loss of smell, headache, body aches, nausea, vomiting, diarrhea. And so those are some of the symptoms when you are trying to figure out, I may have a kiddo that's sick, and what do I do? School has started back. Do I send my kiddo to school? They're having a runny nose and a fever and cough and shortness of breath. Does that mean that that's COVID? That brings another point that a lot of times with the kiddos, you know, they may have a stuffy nose, runny nose, and you're thinking, oh, this, I'm going to go ahead and send them to school. But this is one time where when it says love thy neighbor, it is very true. It rings volumes because we have a duty to not only ourselves, but to our fellow students, parents, teachers, that if your kid is sick, if your kid is experiencing any of those symptoms, then you need to keep your kid home. Because yes, this may be just a garden variety cold, but in the setting that we are in at the moment, those symptoms are symptoms of COVID. And so I do need to keep my kid home. I need to keep my kid quarantined until those symptoms have resolved. But I'm not sending them to school. I'm not giving them any pink medicine and sending them to school and hoping that they'll make it through the day, because that your kiddo may very well have COVID. And here we've exposed the teachers and the other students in their class. Exposure is something that you have to now take into consideration, because when we are concerned about school, my kiddo may not be sick. So I didn't give them any pink medicine. I sent them over to school, but they now I'm scared that they're going to be exposed. What does that mean? So exposure is not all created equal. What the definition or the working definition of exposure is I'm in a distance that is less than 6 feet. So how we are sitting now, how you all are sitting now, I'm close to a person. In addition to the duration also makes a difference. So I'm sitting with a person, whether I'm having a mask on or not, less than 6 feet for greater than 15 minutes. So that makes a difference if my kiddos at school, and let's say they have to go to the restroom, and they go and they walk past one of their friends at school, and they may even high five and say, hey, how you doing? I haven't seen you in a while, and they go their separate ways. That doesn't necessarily, that's not a positive exposure. The risk of transmission from that interaction is very low. Now, you have a kiddo that's sitting in the classroom together at the table, and I got an 8-year-old, and they're in their class together, and they've been in the class for half the day, mask or no mask, and the kiddo at the table with my kid has tested positive. And so then that would be a positive exposure. And so exposure also makes a difference in duration of time and how close we are to each other. Let's say my kid has been exposed, or my kid is showing symptoms. And so now what do? I kept them home from school today. I'm being a good steward. I kept them home. They have fever, shortness of breath, or they have a cough, runny nose, or they've been exposed, and now they're having coughing and fevers. What do I do? And so the testing is now a big one. How do I go? How do I get tested? Where do I go to get tested? You can always reach out to your healthcare provider, whether that be your pediatrician, whether that be your family doctor. Whomever takes care of your family is always a source that you can pick up the phone and call and say, hey, these are the symptoms that we're having. What do we do? What do we do next? One important part is that if you're reaching out for testing, then at that point, you need to be isolated. So if I think that my kiddo has COVID, or I'm needing to be testing them for COVID, at that point, we need to isolate, because one of the big things is we're trying to slow the spread. So while I'm trying to do my due diligence and find out about testing, make sure I'm keeping my kiddo home, make sure I'm keeping them away from other family members, especially those that have underlying conditions. I'm keeping them away. While I am awaiting testing results, I'm keeping them away. All of this is in attempt to prevent the spread. But I want to go and I need to go and get them tested. So your healthcare provider is one that you can reach out to. There are testing sites in our area. So no matter where you may be, you can always go in and you can put in your Google search, you can put COVID testing in my area. And a lot of the places will bring up where you are. You can put in your zip code. It'll let you know where you are. One important part about testing is not all testing sites are free. And so, some people may think, okay, well, I'm going to go over here and I'm going to get tested. When you're pulling up these testing sites, it is important to look at their criteria, because there are testing criteria for each site. They're not free. And so you need to know, okay, if you're looking for a free site, but I'm going to a site that's not free, that information you can find on the web as well. The hours of testing, not everybody tests, they have certain blocks of times that they'll go through and test. So all of that information is you're able to kind of pull that up. Our local health departments are also a good source, because a lot of times with them, you can actually talk to a live person that can kind of help direct and say, hey, these are my symptoms, this is the situation, I'm looking for testing, what do I do? Like I say, if I can't drive anything home while you were going through this process, and I know sometimes it can be scary, it can be frustrating, but just know that if I am getting tested, or if I am looking for testing, or I'm awaiting my test results, that we need to be quarantining and isolating, so that we are taming the spread of the coronavirus. With that being said, that's just some tidbit of information. I'm sure you all probably have other questions and concerns, other thoughts. That information probably brings up questions and concerns or thoughts that I may not have even thought about. So I will quit running my trap and let you all kind of dive in, and we can figure this out together, so that by the end of this, that hopefully we can feel comfortable with the decision that we've made, y'all feel comfortable with the decision that y'all have made, and that everybody out there listening to us, at the very least, know that we are all around having these conversations. We are in this together, trying to do what's best for our kiddos, the teachers, and all the staff that are at the school.
I have a question.
Yes.
As in what all you were saying, I think the assumption that people can make is that kids can get COVID. And
Absolutely.
Information put out recently that kids are practically immune from it, or that the risk of a kid getting it or being affected by it is low. So what is what are the facts or the truth regarding whether a kid can get COVID, and if there's any way to kind of insulate your kid from even catching it?
Good question. So kids can get COVID. Kids can get COVID. There are cases of kids from infancy all the way to the teenagers where they have gotten COVID. With the kiddos, you also will oftentimes hear that the kids will get it, but oh, it's going to be okay. They don't get as sick. And that may be true in some instances. The kids get it and they may, a day or two, they may be fine. But there are kiddos that have more severe course that wind up hospitalized, and there are unfortunately some kiddos that have died. And so when you hear that information, I encourage you to remember, with COVID, every day we learn something. And so I wouldn't rest on the fact to say, oh, well, nope, kids can't get it, because just 3-4 months ago, we were saying, you know what, it affects older people more. But you can see now that people our age are getting COVID, and you have deaths of people that are our age. So yes, kids can get COVID. Kids can also transmit COVID, because that's another thing that you will hear oftentimes is they get it, but they don't pass it. And so what the science is telling us is that kiddos from the age of 10 up until 18, 19, what you consider, if you don't consider an 18, 19-year-old a kid, but they can transmit COVID just as we can. So they can give it to you just as I could give it to you. Those less than 10, at least the science right now is showing that they don't quite transmit it as the older kiddos do or as the adults do. But yes, kids can get COVID.
Okay.
And so when, in terms of like the little kids, like we have a 2 and a 4-year-old who, if we send them to school and we tell them to wear their mask, obviously they're not going to do that all day. So what, I guess, safety precautions that we can be telling our kids if we decide to put them in school, what can we be telling them to do to try to limit that exposure, if there's any, and try to make sure they stay healthy and safe while they're in school?
Good question. I think one thing to take a look at that's very important is a community spread in your area, because we are talking to each other. The virus is not in every area the same. So there are some places that are very high risk. There are some places that the virus is contained a little bit more. And the reason that makes a difference is when I'm equipping them and I'm going to send them back to school, well, how likely are they to come in contact with it in the first place? And so if I have an area that's a hot spot, or I have an area where community spread is quite high, well then your chances of coming in contact with it is higher than if I'm somewhere where the numbers look different. And so then that's one thing as a parent to take into consideration when I'm going to send them back, and thinking about how do I keep them safe? Well, how is it in my area in the first place? What we know that helps to slow the transmission of COVID is mask wearing. Now, the CDC, kiddos under 2 years old, 2 and under, you are wearing a mask is not mandated for them. And the reason being is you're worried about suffocation. Yeah, just like you said, they're not gonna keep it on for one. And then for two, you're actually worried about suffocation. Is there a person, you think about an infant, I can't reach up and take my mask off if I can't breathe. And you all have been in those masks sometimes. I know every now and again I have to kind of move myself and say, okay, just give me a quick breath of fresh air because I feel like I'm suffocating. So imagine that, you got an 8-month-old. So anybody who cannot remove a mask when I need to, you have to worry about suffocation risk. So that for all those parents that have kiddos that are little kiddos, you're not necessarily going to be putting them in the mask. It's not recommended for them to wear a mask. Now, you mentioned about your 4-year-old. And so, yes, you know, my 4-year-old, I can put a mask on my 4-year-old and try my best to talk my 4-year-old in putting my and keeping the mask on. One thing that comes down to the policy and procedures of you all schools or daycares that you are sending your kiddos back to, because for you all's age kid, they are the most important as far as what they are doing, what the facilities are doing, because the kids are only going to be able to do so much. So yes, my kiddo, my 4 and 2-year-old, I taught them how to wash their hands, but are they going to wash their hands without being prompted? Yes, I can send them and put them on a mask, but I really need to know, well, how many kiddos are in the class? You know, what are these policies and procedures that you all have in place so that we are protecting not only our kiddos, but themselves too, because the workers, they have families, their parents, and they have people that they go home to. So it really does boil down a lot to, okay, what are your policies and procedures that you are doing in these facilities where you have smaller kids?
So I don't take for granted that even the 4 of us having this conversation, that we have the privilege of even being able to decide, are we going to send our kids back or not? There are so many parents out there and so many parents probably watching this that don't even get to make that decision because their kids have to go back. I don't take for granted that there are kids who are safer at school than they are at home, and some kids need to be in school. And so you mentioned the policies and procedures. What are some, I guess, questions that parents can ask or things that schools should be doing to make sure that our kids stay safe? So you mentioned kids who are old enough wearing a mask, the teachers washing the kids' hands, washing their own hands, teachers wearing a mask. Is that, what should we be looking for, the procedures for the people that have to put their kids back in school?
So I'll tell you what we know can slow the progression of COVID. Now, what that looks like in a setting such as a school is why we're even having this conversation in the first place, is because that's not what is needed is not always practical. And so mask wearing, we know mask wearing will slow the progression of COVID. Hand washing with soap and water, 20 seconds or longer. If no soap is available, then washing with a hand sanitizer that's at least 60% alcohol based. So hand sanitizing our surfaces that we are, staying away when we are sick. So that goes back to the point that the teacher that doesn't feel well today needs to stay home, now more than ever. The kiddos that don't feel well, I know, like I say, sometimes you got to send your kids to school. I have got to go to work. They don't feel good, but like I said, I'll give them a little medicine and send them to school. But this time more than ever, we can't do that, because you don't know if that time you sent them to school, is it going to be something that they can spread. 6 feet distancing, and so that's always something that even us, we have the conversation about with schools. How do you 6 feet distance kids when they are 25, 30 kids in a classroom? There is, how are you physically able to do that? So those are the things that we know that works. And one of the problems is how is that practical? How do you put that into a policy or a procedure when just by sheer number, I can't social distance 6 feet? And so that herein lies, I think, where a lot of the problem or the frustration or just a lot of the fear comes from, is because what the CDC puts out, how do you institute that?
Were you gonna say something?
Yeah, well, actually, my question I had was sort of kind of following up on one of your initial comments when we were talking about the exposure. And you gave like that 15-minute sort of time frame.
Mm-hmm.
And I just kind of wanted to clarify that, if you can, on like, what does that mean? So it's like literally when we come in contact within 6 feet of someone, that clock starts of 15
Mm-hmm.
minutes, and that sort of kind of determines whether or not that's exposure or not. And so I guess, could you just kind of provide some additional detail on that in terms of the 15 minutes in that time frame?
Yeah, absolutely. So 15 minutes, just like you said, it really does. Now, 15 minutes is kind of a rule of thumb. As we have said 16 million times, is that with COVID, we are, everything is kind of flux. And I know that that's frustrating, but 15 minutes is a good working definition as far as a prolonged exposure. And that clock does start from when you first had that initial contact, less than 6 feet. So if I'm outside talking to my neighbor at her mailbox and I'm at my mailbox, and I can be out there talking to my neighbor for 30 minutes, but my neighbor is 10 feet across from me, that I didn't meet that exposure. The transmission is lower in that regard because we are distance wise. So yes, time wise we were talking for 30 minutes, but distance wise we were greater than 6 feet. And so it's going to be less than 6 feet for greater than 15 minutes. But it does start when my clock, when I first come in contact with you. Mask wearing, one thing that, because you think, okay, well, I had a mask on. Well, when you think about the general public, we're not trained out here to wear, proper PPE. You're told to put on a face covering. Now, whether that face covering, so the 15 minutes or the exposure is with or without a mask, because it's too difficult to try to figure out, well, where's your mask or proper PPE, that you have it on correctly. You might have had it underneath your nose. So the mask that you have on, or wearing a mask or not, doesn't necessarily make a difference as far as exposure. It's the time that we are sitting here together, and it's the distance that we are from each other. So all of us would be considered a positive contact. Now, not you and I, because we're in different places, but Gavino and I sitting here have been in contact with each other now greater than 15 minutes, and we are less than 6 feet apart. And the same for you all. You've been sitting here longer than 15 minutes, and you're less than 6 feet apart. So we would consider this a positive exposure if Gavino indeed had felt sick and ill and tested positive. Now I've been positively exposed.
I think this is a safe, happy space, and that's what we've designed this space for people to be able to have honest conversations. And if I am honest, this whole situation is frustrating. And it's frustrating for a number of different reasons, but because, kind of like you said, in terms of this is what we know works, and then this is practically what we can do, sometimes it seems a little illogical. And it's hard for us to make a decision when we feel like we're not getting the truth sometimes. We're not, I feel like we're left alone on an island to figure out what's best for us on our island. Mm-hmm. And, for myself, I think that's fine, but I think when you take that and you apply it to my children, that's a whole different problem for me. Because as a mother and as a father, as parents yourselves, it's like you want me to risk, not you personally, I'm just saying the situation that we're in, I am being asked to weigh and risk what I look at as my child's life. Because I'm like, okay, if my child goes to school and they get it, and they get sick and there's no treatment for it and something happens, I wouldn't be able to live with myself personally, knowing that I put my kid in that situation. And so we made the decision that we were just going to do the best that we could, and our kids were going to stay home. Even though we both work, we were just going to figure it out. Have you guys made a decision, if you're comfortable talking about what you're going to do with your own kids?
Yeah, so I'll turn this one over to Gavino. With our kids are older. So you all have toddlers, we have teenagers. And so we have a unique kind of a situation. We got a 9th grader that's getting ready to start high school. And so our decision is one based off of the middle of a pandemic, but then you have a student that's starting school. And you all know, high school is one of your best years in school. And so to start your year out, what do we do? And so I'll let Gavino kind of walk us through how we've come to our decision and what we've kind of used to make that decision.
Well, piggybacking off of what you said, Demetrius, it's kind of frustrating. It's very frustrating, actually. When you listen to the media, it's frustrating because they tell us one thing, we turn the TV on the next morning, it's changed. So whereas where kids couldn't get it in the first place, now kids are susceptible. And the way I see it is in reality, it's like, who cannot get a flu virus, right? Everyone can get a flu virus. no one is safe from a flu virus. So why would this virus be any different? Anybody can get this virus. And they should have been saying that, in my opinion, from the jump, is that kids as young as 9 months old to grown-ups, as old as 80 years old can get it. I've had several family members in my family get the coronavirus, and honestly, it's amazing that they live, because a couple of them have had underlying health problems, and they pulled through. They pulled through. So I also think that the coronavirus, I think it hits individuals differently based on their health, if you know what I mean. So going back to the schooling, our son, he's going to be 14. He's 14. He's going to be in the 9th grade. Our daughter, she's going to be in the 7th grade. 7th grade. And it's a little difficult to make the decision this year, more so for our son, because he's starting his first year in high school. And I remember my first year in high school, even though I was going with a lot of my friends, I was still terrified. Honestly, I was nervous. It was a big school. And this time around for my son, he's transferring schools. So he's not going to his school anymore. Although his school goes from 6th to 12th grade, we opted to transfer him because he wanted to play soccer. It's one of the biggest reasons. And also the school that he wants to go to has a veterinary program. So being this whole COVID situation, we don't know if he's going to be able to play soccer or not. That's a whole UIL thing. And we don't know if he's going to be able to experience the hands-on aspect of the veterinary program. Because from what we heard is that they allow civilians or people from the community to bring their pets in to be examined and practice on. So with this whole COVID thing, I don't see how the school district would be able to allow outsiders, under such a strict, I guess, health concern, outsiders to bring their pets in to be examined. Where, how are they gonna wear masks? Who's gonna make sure that they wear a mask? I mean, these are teachers, these are administrators, but they're not security guards, they're not police officers. I mean, out there in the world now, we have issues with people not wearing masks. So how are you gonna say, oh, well, you can't come in here, you don't have a mask on? It's gonna be a big problem. So it's, we opted to keep them home now. And I think things will be all right here. Like I said, they're teenagers. One of them is teenager. One of them is almost a teenager. And they're both very intelligent kids and well-mannered, well-behaved, I hope, sometimes.
Can they help us with our kids?
Yeah, and the bad problem is that that's us. Like you were saying earlier, Demetrius, is not everybody has that luxury. There are several of my friends, my family members who have young children who are in elementary school, who are in daycare, and who have to go to work. A lot of people use schooling and as a daycare somewhat, and we're left with no choice. Especially low-income families, middle-class families, we're left with no choice. We have to, single parents, single mothers, single fathers, we have to send our kids to school because we know that they'll be taken care of. We know that they'll eat breakfast, lunch, and maybe even dinner sometimes at a Beyond the Bell program, at an after-school program. They give children food there too. So, it's kind of like a best case scenario that we usher our kids into school, but at the same time, we must be accountable for what may happen. I think that's another thing too, is the lack of accountability. Is everybody just says, these are the guidelines, now do with it as you may. So it's kind of difficult, like.
Right. Yeah, and I like everything that you said is stuff that I think we're all talking about and all thinking about. Just to summarize what I got out of what you said, Dr. Ramos, in terms of for the people who have to send their kids back to school, because we all acknowledge like some people are gonna have to do that. You said that kids can get it, yes. If they have symptoms of it, to keep them home, to isolate them until you're able to get a test result. And is there anything else that you would add, just those bare bones facts of like, hey, for those of you who are sending your kids to school, this is what you need to know?
I would just like to say something real quick, and my wife, Dr. Ramos, can definitely go into deep depths here, but I don't want us to forget that we're approaching that flu and cold season,
Oh, yeah.
so I don't want us as parents to just dismiss, oh, the sniffles or a fever as a cold or a flu, and we send them off to school, and next thing you know, they're full-blown coronavirus,
Right.
so it's kind of a touch and go situation, but I just wanted to reiterate that.
Just a follow up to that, I hear that when you have like an underlying illness, that kind of makes you more susceptible to COVID. So being that we are entering into like
Flu season.
the flu season, if you are to come down with something else, should they be taking like even extra added precautions to make sure that, or try to prevent being exposed to COVID situation?
Yeah, that's a good question. And it's a beast that we haven't quite tackled because COVID started at the end of flu season. And so the end of flu season ended abruptly because all of a sudden now cough and fever and shortness of breath was COVID. Until proven otherwise, it's COVID.
Mhm.
And so flu season kind of abruptly ended, but it is coming back again. And so it's a beast that we have not yet even begun to tackle. Think about, yes, and we're all thinking about it, but begun to tackle. How do you differentiate? When we said the symptoms of COVID, they sound just like the symptoms of flu. I mean, you can mirror them. So it's difficult. And one thing that you said, Chris, so kiddos that I didn't mention, but you just made me think about it, is that kiddos have underlying conditions too. Kiddos have asthma. There are kids who have suppressed immune systems. So kiddos, just like us, they have underlying medical conditions. And so getting COVID, having an underlying medical condition doesn't make you more susceptible to getting it. So you're not any more likely to get it. It just makes it increased risk of complications. So it increases the complication risk, but it doesn't make you any more likely to get it. So, whether you have asthma or you don't have asthma, then you take your same precautions all the same. So the precautions across the board are the same for us all. But like I say, somebody that does have an underlying respiratory or diabetes, or kids who have diabetes, those obesity. So obesity is one big risk factor that the CDC added on not too long ago. So though we need to be taking precautions. And hopefully I answered your question, and Demetrius to answer your question. Sorry, to answer your question. So the driving points is, one thing that I want to reiterate to parents is that it is not a choice or a decision to have guilt about. It is no room for guilt, because you're going to have to make one of the hardest decisions that you probably have had to make. And there are a lot of factors that go into that decision. So it is not a right or wrong. It is not a right or wrong. And you make that choice that's best for your family and your situation without judgment. So if I cannot reiterate that enough, is because this is a tough situation. And as you can see, we've gone through this. There is no right or wrong. It's just making what's best for you. So make that decision and take the guilt out of it, because we have enough going on and you are doing the best you can already as a parent. So take that out of there. If I do have to send my kid to school because I can't keep them home, some kids learn best in school. My kiddos, I actually honestly think my kiddos learn best in school environment. They do. We're interactive people. They're interactive learners. And so they would learn best in the classroom. So you may have some people who can keep them home, but feel like they would do better in school. So then they may want to send them to school. So it's not, not everybody who can keep them home may want to keep them home. So for anybody you're going to go to school, like I say, know what's going on in your community. Know my transmission rate, because if it's if it's an area that has a lot, then you have to kind of take that into account and think about, what's my risk to my kid if there is a lot of spread in the community. If I'm going to keep my kids home, teachers, I'm going to stay home. Anybody, the lunchroom, the front in the administrative office, anybody that's not feeling well, if more now than ever, stay home. I'm washing my hands. I'm going to be wearing a mask. if my kiddo is going to have to be out there, and if they're age appropriate enough to wear a mask. Like I say, sometimes we're talking about school, but daycares are alike. So they're not going to school, they're going to daycare. But masking the ones that can mask are always to try your best to kind of keep them safe if you got to send them out there.
And I would add too, in terms of your no judgment, that hit home for me, because I think that's the best thing that you can tell people is like, nobody should be judging. If you send your kids back to school because that's what's best for your family, great. I applaud you for making that choice for your family. If you choose to keep your kids home, great. I applaud you for making that choice. I know for us, a thing that has helped maintain the stress a little bit is being flexible and knowing that I may have made the decision today that it was best for me and my kids to stay home, but this is ever changing and every day looks different for us. And so for us, we actually put our kids back in school at one point. There was a positive test at their school and then we pulled them back out. And we had to be okay with, like you said, not having judgment for each other, for changing our opinions, and really coming together and communicating and saying, hey, last week, the decision that we made was this. This week looks a little different for me. And so this week, this is what I'm gonna do. And just, not judging yourself, not allowing other people to judge you, and just doing the best that you can for you and for your children and for your families. So Dr. Ramos, I would like to ask you something. Here at Claire M Motivators, we like for people to leave our conversations feeling motivated and not stressed and drained. And so what is something that motivates you in terms of thinking that parents are going to be able to get through this and make the best decision for their families?
Good question. So believe it or not, teachers. Teachers are near and dear to my heart. All of us sitting here has a teacher. You have a story. You're sitting where you are because somebody taught you, because somebody invested in you. And so what motivates me are the teachers. I know this is a frustrating time. I know firsthand that it's frustrating, but we got to get this right. We have to get this right for them, and they're out here. We're thinking about it strictly from a parent perspective, but imagine being a teacher and a parent. So now I'm thinking about my kiddos I have at home, and I'm thinking about my 20 kiddos, and you all know teachers, those kiddos at their school, no matter their age, those are babies, those are their babies. And so they're thinking not only about their babies in their house, but they're thinking about their babies in their classrooms. And so teachers, for all my teachers out there that teach whatever grade, whether from daycare all the way through, stand with you all. We are trying to get right so that we make the best decision for you all, not only just for our kids, but for your kids, for us all. We're in it all together. So you teachers, all you all out there that's trying to get through this and cycle through this, you all motivate me.
Good. That's awesome. Well, thank you for stopping by to share your knowledge with us and for letting us relieve a little bit of stress for a second to tell you about how frustrating this all is. But we are all motivated and inspired by our healthcare workers and our teachers and our parents, everybody that's pulling together as a community and saying, hey, we don't know all the answers, but we're willing to put all of our hands in and figure it out together. So I hope y'all have a great, great day. And I hope that everybody watching learned something. And we will see you guys next week, because we're going to do another series of this to talk about COVID and adults and what we should be considering when we're moving about, going to the grocery store and going to work and things like that. So thank you very, very much, not only for all you do, but for sharing that with the world now.
Absolutely.
Bye.
Bye. I have a good one.
You too.
Bye.